You know that feeling, right? Maybe after a weekend game or just moving wrong, you get that twinge in your knee, that sharp pain. Or maybe it's just an ache that hangs around.
Mm-hmm. It happens. And it's tempting to just, ignore it, hope it goes away.
Exactly. But today we're doing a deep dive into why that might not be the best idea. Why listening to your knee and acting fast is actually, well, really important for your health down the road.
Yeah, absolutely. We've been looking at some information from a chiropractic clinic down in Spartanburg, South Carolina. And they really emphasize this point about timely action for knee injuries.
Right.
Think of it like a warning light in your car. You wouldn't ignore that, would you? Well, maybe some people would, but ideally not.
Hopefully not for long anyway.
Right. Your knees are kind of similar. Catching things early can stop much bigger problems from developing.
Okay, so think of this conversation as your quick guide to understanding knee stuff. We'll touch on how a chiropractor might approach treatment, but maybe more importantly, we'll get into why putting off dealing with it is potentially risky.
Yeah, the goal here is pretty straightforward. We want to pull out the really essential insights so that you feel equipped. If you or someone you know runs into a knee problem, you'll understand why acting quickly it can make a huge difference.
Our mission then is basically to understand why getting knee injuries looked at ASAP is so vital and what sort of negative consequences can happen if you wait too long.
Precisely. Understanding that domino effect of delaying care.
Okay, let's start with some of the treatments then. What kind of things might a chiropractor do for a knee injury based on what we saw?
Well, the info highlights a few common methods. One big one is manual manipulation.
Okay.
And this isn't, just random cracking. It's about skilled adjustments to help restore proper movement, reduce pain.
Yeah.
And it's not always just the knee. They might look at the spine, other joints, making sure everything's aligned because that can impact the knee.
So looking at the bigger picture, sort of.
Exactly. It's about the body's overall mechanics. Then there's traction that involves gentle stretching. It helps take pressure off the joint, can reduce inflammation, and improve mobility a bit.
Okay.
They also mention electrical muscle stimulation, EMS, that uses these mild electrical pulses. The idea is to help bring down swelling and ease muscle spasms around the knee.
Right, right. And I guess things like ice and heat come into play too. That seems pretty standard.
Oh, definitely. Ice and heat packs are, fundamental. It usually depends on the stage of the injury. Ice for acute inflammation, heat for maybe more chronic stiffness, getting blood flowing.
Makes sense.
And exercises are key. Not just any exercises, but specific stretches and strengthening routines. These are designed to boost circulation, help with inflammation, and crucially, get that full range of motion back in the knee.
Okay.
Massage is another one they list, working on the muscles and soft tissues around the knee. Releasing tension there can make a big difference to pain and movement.
Yeah, tight muscles can really pull things out of whack.
They can. And finally, things like orthotics or bracing might be used. These give the knee extra support and stability while it's healing, stop you from straining it further.
That's quite a toolbox, actually.
It is. And like the source material rightly points out, these are just some of the potential tools.
Right, it's not a guarantee they'd use all of them.
Exactly. And they really stress getting personalized advice. You need a healthcare professional to figure out what's right for your specific situation. They even mentioned a specific chiropractor in Spartanburg, Dr. Vyacheslav Korokov, as an example of someone who specializes in this.
Yeah, that tailored approach is so important, isn't it? What works for one person's knee might not be right for another's.
Couldn't agree more. Understanding the options is good, but a proper assessment is always the starting point for an effective plan.
Okay, so let's shift gears a bit. Let's really hammer home why it's so critical to deal with a knee injury quickly. The reasons seem pretty compelling.
They really are. The core message is basically, don't wait. And the first big reason is preventing further tissue damage.
Okay, what does that mean in practice?
Well, think about a minor sprain or tear. If you rest it, ice it, get it looked at quickly, you limit the damage. But if you push through the pain, keep using it.
You make it worse.
You make it worse. Those small tears can get bigger. You might damage ligaments more or even start affecting the cartilage. Early treatment helps stop that cascade of negative stuff happening at a cellular level. It limits inflammation, limits tissue breakdown.
So acting fast might stop a small problem becoming, say, a ligament issue or a cartilage problem.
Potentially, yes. It heads off more serious structural damage. Another key point they make is faster recovery.
That seems logical. Less damage equals quicker fix.
Pretty much. When you jump on an injury early, you're working with your body's healing process right from the start. You minimize the initial mess, control the inflammation.
So the body has a cleaner slate to work with, kind of?
Exactly. It creates a better environment for repair and regeneration, which means, getting back to normal knee function, back to your activities much faster.
Getting back on your feet sooner, we all want that. What about the pain itself? That's often the most immediate concern.
Right. And immediate care offers quicker pain relief. Acting fast, even just with the basic rice stuff, rest, ice, compression, elevation, that can significantly cut down inflammation and discomfort right away.
Mm-hmm.
And then getting that professional diagnosis early means you can start targeted pain management sooner, addressing the actual cause of the pain, not just masking it.
Okay, so it's not just about immediate relief, but it sounds like it's also about protecting the knee for the future.
Precisely. The source really stresses avoiding long-term complications. Untreated or poorly treated, knee injuries can linger. They can lead to chronic pain, that feeling of instability, maybe you lose some range of motion.
Things that really impact your daily life.
Hugely. So by tackling it promptly, you're taking steps to prevent those long-term headaches and keep the knee working well over time.
And one specific long-term issue people worry about, especially as they age, is arthritis. Does early treatment play a role there?
Yes, definitely. They specifically mention minimizing the risk of chronic issues like osteoarthritis.
How does that work?
Well, an injury triggers inflammation. That's normal.
Yeah.
But if that inflammation isn't managed well and becomes chronic, it can start to wear away the protective cartilage in the joint.
Ah, okay.
So prompt, effective management helps control that inflammatory process early on. It protects the cartilage, the ligaments, all those crucial joint tissues, and that reduces your likelihood of developing arthritis in that knee later on.
Wow, okay. Those are definitely some powerful reasons to take knee pain seriously from the outset. The info also had some FAQs, common questions people ask. Let's run through those. What happens long term if someone does put off getting treatment?
Yeah, the FAQ paints a pretty clear picture there. Delaying can lead to, well, a bunch of undesirable things. Your pain might get worse, become chronic, harder to manage.
Right.
Your mobility is likely to decrease. Simple things, walking, stairs might become difficult.
Yeah.
There's a higher risk of developing arthritis, like we just discussed. And, kind of ironically, waiting might mean you end up needing more invasive treatments, eventually maybe surgery that perhaps could have been avoided.
So waiting doesn't necessarily mean avoiding bigger interventions.
Not at all. Plus, your recovery time will probably be longer if you wait, and there's a greater risk of other complications cropping up. Basically, you risk letting a manageable issue snowball.
Okay. And how does getting treatment early actually help stop more damage inside the joint?
Think of it like damage control. Early treatment tackles the injury right at the start. It helps reduce that inflammation before it gets out of hand and starts damaging other tissues.
Okay.
By managing it properly early on, you prevent those complications we just listed. You also promote faster healing. And often, early rehab includes exercises to strengthen the muscles around the knee, which add stability and protection against future problems.
So it's about stopping the negative cycle early.
Exactly. Stop the cycle of pain, inflammation, and further damage.
What about the specific benefits of actually going to see a professional soon after you notice a problem?
The benefits are pretty significant. First off, you get a proper diagnosis. You actually know what's wrong, which is crucial.
Oh, right. No guesswork.
No guesswork. And that leads to a tailored treatment plan that's right for you. It's obviously key for preventing further damage. It helps reduce pain and swelling more effectively than just waiting it out. And, as we keep saying, it really speeds up recovery. Plus, it's your best bet for preventing long-term issues like instability or arthritis. And you get professional guidance on rehab, the right exercises at the right time to get you back safely.
So acting early really seems to stack the odds in your favor for a good outcome. How does it specifically improve the chances of, a successful recovery?
Well, by catching the issue early, you limit how bad the initial injury gets. That right there promotes faster healing. Early intervention is usually much better at reducing inflammation before it digs in and becomes chronic. It allows for quicker restoration of mobility. You could start those crucial strengthening exercises sooner, building support for the knee. It all adds up to giving your body the best shot at healing properly and completely, minimizing the risk of problems lingering.
And the last FAQ point was about quality of life. How can delaying treatment really affect your everyday life?
Oh, profoundly. If you let a knee injury go untreated, you could be dealing with chronic pain that just wears you down. physically and mentally.
Yeah, constant pain is draining.
It really is. Then there's limited mobility. Maybe you can't play with your kids or grandkids like you want to. Maybe you have to give up hobbies. Maybe even just getting around the house becomes a chore.
That sounds awful.
It impacts everything. And if the injury worsens, you could face those long-term consequences, arthritis, permanent damage which can seriously affect your independence. So, the message is clear. Timely treatment isn't just about fixing a knee. It's about protecting your ability to live your life fully, protecting your physical and emotional well-being.
That really puts it into perspective. It's not just a joint, it's how you interact with the world.
Exactly.
So if we boil all this down, what's the single most important takeaway message?
I'd say it's this. Don't underestimate knee injuries. Getting prompt attention isn't just about feeling better now. It's a crucial investment in your long-term joint health, your mobility, and, frankly, your overall quality of life.
Right. The knee is so complex, so essential for almost everything we do. Taking care of it quickly just makes sense.
Absolutely essential.
Okay, so quick recap then. We touched on some potential chiropractic approaches, manipulation, traction, EMS, exercises, that sort of thing. But the big focus really was on why jumping on a knee issue early is so vital. It's about preventing more damage, speeding up recovery, managing pain, and crucially, avoiding those serious long-term problems like chronic pain or arthritis that can really diminish your quality of life.
Well summarized. And that leads us to maybe a final thought for everyone listening. Think about how you usually react to those minor aches and pains. Do you tend to wait and see? Or do you get things checked out? Maybe after hearing all this, you'll think a bit differently next time your knee sends up a warning signal.
Mm.
It's really about being proactive, listening to your body, and not underestimating how important knee health is for your overall mobility and well-being in the long run.
Definitely food for thought. Thanks for exploring all that with us today.